For the last 10 years, the Calgary Rural Primary Care Network has been providing primary care services to 14 communities surrounding Calgary. From Lake Louise to Bragg Creek, from High River to Vulcan, and all the way to Strathmore, we've grown to over 130 family doctors and 30 health team members today. These health team members provide ongoing primary care to you and play a key role of your medical home, a place where you should feel the most comfortable going for all of your healthcare needs. What impact do you think the Calgary Rural PCN has had with our communities over the last 10 years?
Population certainly in our PCN geographic areas has grown substantially. We now have, I think 35 clinics, 130 some plus doctors working in our PCN now.
It's changed quite a lot over the 10 years. First of all, when PCN started, there was no entity like that at all. That we with Alberta Health Services can kind of make plans for program development in our communities.
And we've worked quite collaboratively with them to develop programs that are building healthy communities.
I've really found that the support that the PCN has given to health promotion and community development has strengthened the community's understanding of the PCN. More people have been able to access services, and it's been just absolutely wonderful for the community.
How do you think patient care has changed?
I know for all family doctors, especially in the rural, I think there's just more of an attachment in that relationship. But what it has helped me do is in those places where I know that there just wasn't anything for them outside of my four walls, I've been able to help organize and facilitate and plan programs that I can get them involved in other things.
Patient-centered care was going to become to the forefront, improving the quality of life for physicians and ultimately improving the quality of the patient's own visit with the doctor and improving access. That was another key point.
PCNs have played a big role in changing how we perceive how we delivering care, especially with context of team-based care. There's definitely better coordination between different healthcare providers to provide optimal care to our patients. By improving primary care, we actually are, in a way, keeping patients out of hospital. We are improving health outcomes. We provide better care in general to our patients, better connections to our patients, and I think in a way it makes us more engaged as primary care physicians and primary care providers.
What do you think are some of the positive changes you've seen?
The other really positive thing that the PCN has allowed us to do is to really unify all the family doctors within the PCN. So we're a bunch of rural family doctors and we're just used to kind of going to work, doing the job, going home at the end of the day. And so this has really allowed us to kind of advocate for family practice as well as for our patient group as a whole. So it's brought family doctors together with Alberta Health Services, and we've been able to really fill in holes in service delivery that we've seen over the years.
So this has really helped with that connection of physicians to know each other. It also has helped bring them together with our partners, so more physicians know their Alberta Health Service counterparts that maybe would not have under primary care networks.
Some incredible amount of good people working in our PCN who has truly made our PCN what it is today.
What do you think the future looks like for the Calgary Rural PCN?
We still want to respect what the needs are of the communities, but we've also, 10 years now, have an opportunity to have learned from each of the communities of what works well, how do we manage gaps in services, how do we work better with our partner, Alberta Health Services.
To deliver coordinated, timely care to our patients. We're thankful that we have the enormous support, now more so from government, and that we've been recognized as an important player, and that we have incredible people.
Even though probably there's still a large percentage of patients or community members who don't know what a primary care network is. Those who do really seem to endorse it and are very on side. So I'd like to thank those people also for helping, help us grow and help us become more recognized as a good conduit to the healthcare system and helping to solve primary care problems in the community.
Blessed by, colleagues who's very engaged, and blessed by patients who's cooperative in regards to trying to make their healthcare better for themselves. Community support, the patients, colleagues, and I'm hoping that we will continue to work together as to improving attachment to physicians, our medical home development, and in that way improving patient care for the long term.
It has been our pleasure growing with you over the past 10 years, and we look forward to helping you stay happy and healthy for another 10.